Feeling overwhelmed in nursing school? You are not alone. In this video, I will share 5 powerful study tips that will help you stay on top of your game and actually enjoy the process. So let's dive in. First tip we have here is master active recall and spaced repetition. So do not just reread, quiz yourself. After studying the material or studying the topic, you go back and do a little self-quiz on what you have done. Do a self-assessment. Continue to reassess yourself on what you have studied. So after doing your assessment, you find out the deficiencies you have and then go back to it and fix it. Spaced repetition help move info to your long-term memory. So if you practice this regularly, you find out that it's going to be moved to your long-term memory. Let's see an example here. You can create flashcards on pharmacology topics and review them regularly. This is going to help you. Let's look at practical application of this. Create 20 flashcards per week and study them. After that, you do a review. You put the flashcards away and assess yourself. Thereafter, you can schedule review sessions on specific days. You can say, I'll do my reviews on Sundays, or I'll do my reviews on Saturday. So whichever day you choose, you do a specific review. After the general review, the normal review you do regularly, you do specific review on everything you've done on that week. You do a specific review on that particular day. You could choose Sunday, you could choose Saturday, any day that fits your schedule. Tip 2, time blocking is your secret weapon. Have a schedule for everything you do as a student. It's going to help you build discipline as you study. You have time for your lectures, you have time for your studies, and especially time for rest, because you need that also. You can also try Pomodoro. It's a method that lengthens your attention span. So let's say you want to read for 3 hours and your attention span will only permit you to read only 90 minutes. So if you try this technique, you study for 25 minutes. After that 25 minutes, you go for a 5 minutes break, and then you come back again and repeat it. You find out that at the end of the day, you can do more than 3 hours. Google Calendar or Planner is a must-have. It's going to help you plan your schedule for your day. Let's look at an example of time blocking. Say like on Monday mornings, I'm going to look at med-surg. After reading med-surg in the Monday mornings, according to my schedule here, I have practice questions in the evening. So after studying in the morning, I'll use my evening period for practice questions. You can also add clinical hours and rest days to your schedule. It's very important. Review progress every Sunday or any other day you choose according to your schedule. That is when you have that is the day you pick out to review your progress. You can also color code your calendar to keep it fun. Use different colors to make the calendar look good. You can use different color codes for different activities like your rest time, your study hours, anyhow you want to do it. Just make sure it fits. Tip 3, teach to understand. You can teach a friend or even your pets. You can also record yourself explaining concepts. Another thing you can do is to use the Feynman technique. The Feynman technique is a simple 4-step method of deepening your understanding of complex material by teaching it in plain language. Teach this. You deepen your understanding of that material by teaching it in plain language. Let's say we are talking about diabetic ketoacidosis, or let's say vital signs. So it's a 4-step method of deepening your knowledge. So this is how it works. You choose a concept and write it down. Like I said before, vital signs. You write vital signs, then you prepare a lesson on it, and then explain it like you would to a novice. Let's say you're a senior student explaining it to a first year student, explain vital signs to a first year student. So you explain, you know that person is a novice. So you explain that concept like you would to a novice. And then after explaining that, you identify your knowledge gaps and go back to the source. If you identify that you don't know the actual value for blood pressure, or you're not sure of it, as after doing that first review, you go back and review from the source. You go back to your books and know the actual range of normal blood pressure. And then the first step is review, refine, and teach it loud. So after reviewing it, you refine and teach loud. You can teach your friends or members of your study group. It's going to help you. Form or join a small focused group and assign topics and take turns to teach. Let's say they want to teach liver cirrhosis. You're going to split the topic. The first person takes the anatomy and physiology of the liver. That's going to help you understand it better. Then the next person talks about the etiology and the pathophysiology of the disease. And the third person may talk about the management. So after doing this, you can come back and review. teach yourselves. Keep sessions under 90 minutes. So this is going to help you study group. This person studies, the other person studies, you also study, and then come together and teach each other. Teaching others boosts retention. Tip 4, focus on high yield topics. Prioritize what is tested. You have critical medications, lab values, or ABCs. ABC is an acronym used when resuscitating a patient. The A there stands for airway, B stands for breathing, and C stands for circulation. So the first thing you are going to do when you see this patient is to assess, are the airways open? So if the airway is not open, your priority is to open the airway. The next thing you check is for breathing. If the airway is open and the patient is not breathing, you're going to try to establish breathing for that patient. NCLEX style questions are the gold standard. So prioritize NCLEX style questions, because those questions are kind of trickish. So if you prioritize those NCLEX style questions, it's going to help you even in your school exams. You have to master the exam mindset. You practice at least 20 questions daily, and then you review the rationales. It's going to show you why you got these questions correct or why you get the other one wrong. Then track tricky topics like that. These ABCs I just mentioned. Topics like diabetic ketoacidosis, and so many topics that are tricky. You practice them and take mini assessments every 2 weeks. This one is different from the regular assessment you do. This mini assessment is like giving yourself an exam. Every 2 weeks you take this exam based on all what you have studied within these 2 weeks. Give yourself an exam. It's going to help you to keep the fire burning. The last but not the least tip I'm going to share with you is prioritize self-care. You have to take care of yourself. Sleep is brain fuel, so you have to aim for at least 7 to 8 hours of sleep in a day. Always stay hydrated, and remember that exercise improves memory. Don't ignore mental health. Talk to someone if you're having any problem. If you feel overwhelmed by work, you feel overwhelmed by studies, you can talk to someone. Have somebody you can always talk to. So schedule short walks or stretches. It's a kind of passive exercise that is going to help you improve your memory. Always have a bottle of water with you, so you can always sip when you feel dehydrated. So don't dehydrate. You can journal or meditate 5 minutes a day. It's going to help you to improve your focus. And last but not the least, reward yourself after each tough study sessions. You can get yourself a gift. You can do something nice for yourself. It's a kind of reward that you get after studying. In conclusion, consistency beats cramming. So which tip was your favorite? Comment below. Like, share, and subscribe for more study hacks. You've got this. Your future patients are continuing.